Hello, I'm Dr. Blair, and I'm going to be talking about cannabidiol, specifically about the performance enhancement capabilities of cannabidiol. We'll dig down into some of the weeds here and talk about some concepts that you may not be familiar with. I'm excited to bring this portion to you because performance has always been an important aspect of my life, whether it was in the Army and training at West Point, cognitively, or whether it was had to do with physical exercise that I've maintained over the last 66 years and continue on a daily basis. These are very important to me, and so I think I'm fairly observant about those important things that happen because of cannabidiol, and I'm watching those things pretty closely. What we're seeing here in the agenda I've got listed for you is that endocannabinoid system overview. I want to review with you. We'll look at how CBD establishes or some of the established benefits of cannabidiol. What is performance, and what am I talking about when we're talking about performance? And then the different aspects, as I break down performance, the different parts of performance that cannabidiol has a particular approach and an effect on. And then lastly, we're going to talk about some head trauma, and I'm going to give you a new concept of things to look for and how to conceptualize what head trauma really is instead of what we're so often told. When we're talking about the endocannabinoid system, this is the basis for a lot of the action for cannabidiol, and I want to give you an overview of what the endocannabinoid system encompasses. So the endocannabinoid system is involved with the brain as well as all the organs and all of the neurological tissue, the peripherally, our spinal cord, as well as our immunologic system. It's probably the master regulator for our hormonal reactions, our ability to function, as well as to repair. Now, all of these encompass quite a great deal of the body and the body function, but unfortunately it's not well recognized. Cannabidiol is something that works in the area of the endocannabinoids, but it actually works in a much broader capacity, working on signaling systems that are well beyond just what the endocannabinoid system is. So that's the basis for why cannabidiol works and is effective, because it's working within that endocannabinoid system, but also goes well beyond those things. If we're looking at the established benefits of cannabidiol, in some of the previous talks, I've discussed the anti-inflammatory and the immune regulatory effects that cannabidiol has, as well as the neurologic, the fact that it can turn down the volume on some pain signals in a retrograde fashion at the synapses, the anti-tumor effects, and of course the overall endocannabinoid system enhancement, restoring the endocannabinoid system when it gets out of balance, when there's a dysfunction that's going on, as we see with many of the syndromes. And then some of the benefits that we always see that are part of the well-established benefits of cannabidiol: the anxiety reduction, the analgesic, the mood lifting, improved sleep, improvement of the gut function, and improvement of the skin. So those are all things that are pretty well established and we've talked about before. But now I want to dig into some of the things that we can look at in terms of performance and athletes, as well as people who are training or have a demanding physical job. So we usually think of sports performance in terms of, well, it's all physical. Well, those professionals out there and those people who are aspiring to be professionals know that it's much more than that, that there are really at least 4 different areas that I look at and I see in the performance aspects of sports. Well, actually, it can be considered in all major activities that you're engaged in. You're going to have to approach all of these things, and you're going to have to be in the perfect mindset to be an Olympic athlete and to have your optimum ideal performance. So in the first area, we're talking about cognitive, and this is so important, not only for training, but also for performance. There's no question that the individual, the sports-minded, and I think maybe it's a good idea to stay targeting let's say an Olympic athlete. We'll look at what that person is doing and how they perform and what aspects are really important. So if we're looking at that Olympic athlete, we're saying, well, he's got to have a clear focus. He's got to know what he's doing. And I don't mean to be man or woman. I want to use an example that's easy for us to talk about. So we're going to be focused on the goal, the end goal, but the better focus that an individual is, the better performance that they are going to be able to establish. There's a high level of concentration, of task orientation, getting the job done each step of the way. And for those Olympic athletes, they're going to need to know they've got to have, maybe if they're a runner, they've got to have their foot in the right place, they've got to be landing properly, and they've got to be processing the information cognitively. They've got to be thinking about, and when things change, when strategies have to change, they've got to be able to process quickly those situations so that they can recover or they can take advantage of special advantages that may come up. And finally, in terms of what we see with the cognitive focus, we're talking about learning. And all of these things that I've listed here, these 5 items, are all things that CBD has been established to make a difference for in neuroplasticity. So we're talking about learning, reestablishing new neuron networks. CBD has been clearly shown to establish that neuroplasticity and to reestablish those connections, or CBD has been clearly shown to establish those connections and improve those connections for learning and to accelerate and enhance the learning effects. But we also see those other things, the focus, the concentration, the task orientation about getting things done, and improved speed of processing. So some major advantages that we get from cannabidiol, they're subtle, they're not always recognized, and unfortunately we don't have a lot of detailed human studies that emphasize these particular points. And then the mood and the emotional aspect of the athlete is also very important. The confidence, the mood, controlling anxiety and fear, and these are all areas that CBD has shown spectacular results and improvement over. So if you have all of these things working in your favor, then you're going to be ideally set up emotionally to handle those situations, to reduce the anxiety. You all know how fear interferes with our performance, our anxiety that's there. If you can reduce that fear, and if you can reduce that fear memory, then you're going to be able to perform stronger, harder, and with a greater resilience than you have in the past, and you can get your optimum performance. Along with that, the confidence and the positive mood is going to help keep you in the pink for highest possible performance. I know everybody was kind of focused on the physical aspects of what performance meant. And so this, I want to pay tribute to that. I want to talk about some of the details because they really are stunning. With regard to metabolism, we're seeing cannabidiol working within the cell to shift away from the glycosis using the glycolytic cycle that burns glucose, which is not really very efficient. Instead, we're having the cannabidiol is shifting the metabolism over to the oxidative process, which is going to generate maybe 6 or 7 times the energy that the glucose process encompasses. In addition, it's shifting the body over to release the fat from the body so that you're going to have a higher energy source. It's like burning oil versus burning wood. You're going to have a higher energy source, you're going to get better performance and much more efficient function. Now, right down to the mitochondrial level, we're seeing CBD being involved with the cell, where we actually see receptors cannabinoid receptors on the mitochondria that are signaling changes both in the inflammatory substances that come from the mitochondria, as well as the performance and the conduction that's going on within the cell, particularly within the mitochondria and its function. In addition, we're seeing enhancement of, in the physical capacity, people's endurance. You correct these metabolic issues, people and the sports and the athletes are performing and they're maintaining, and their conditioning and endurance has improved. They have the ability to go longer and harder and present a maximum performance with that. Now, one of the reasons why that may be occurring is because there is a pain tolerance increase, so that athletes are able to handle the modicum of pain that they have, or a major pain, by using the analgesic properties of CBD and the anti-inflammatory that is also there. So with the improved pain tolerance, you're going to have, again, better endurance, being able to push harder. I know the first reaction is, well, if my pain tolerance is too high, then I could injure myself. That's true, and that's possible. So it's a consideration that you have to take in. But we're not talking about a pain tolerance that is due to an artificial substance or an opioid. We're talking about natural mechanisms and having turned down the volume of the pain signals that are there, not turning them off completely. And when we look at lactic acid, you have that flooding our bodies after the muscles have become exhausted, exuding the amount of lactic acid from anaerobic activities and energy burning. We're going to have a better tolerance. And lactic acid can be irritating and can cause quite a bit of pain. But with cannabidiol, reducing that pain and reducing that stimulation, you're going to see a reduction in the discomfort that's there and a greater tolerance for those anaerobic type of exercise, like the sprinting. In addition, for some sports, breath holding is quite important. And cannabidiol can actually double the breath holding capability of some of the athletes, particularly for divers, where a breath holding is required. But it's an easy test to perform on yourself to examine how long you can hold your breath when you're not using cannabidiol and how long you can hold your breath when you are using cannabidiol. And I think it'll surprise you at the difference that's there. And finally, but not least important, is the recovery that cannabidiol enhances. We're talking about reducing inflammation. You know, one of the largest impediments to healing within the body, whether it's a wound or an injury, is the inflammation that accompanies those types of injuries. If we can reduce that inflammation, not eliminate it, we need to have some amount of inflammation, but if we can reduce it to a small amount, then we can enhance the healing process. Then the inflammation doesn't interfere with the process of, and we can reduce the number of macrophages in the area, the cytokines and the pain, and we can get along with and move along with the healing process and repairing the tissues that may have been damaged. Of course, we have the analgesic effect that's going to go with the CBD. So you're going to have improved movement and we're going to have less reservation about moving and activities, and so you're going to have better function along with that movement. In the case of vigorous exercise, after hard workouts, you're not going to have the soreness. You're going to be able to continue with your activities. You're going to be able to take part in the next day's activities or the next training day without fear or discomfort in that process, as a reduction in that pain. Now, there's also the neuromuscular protection that goes along with that. So if there is an injury, we're going to protect the nerve system and the muscles in that injury. Time and time again, there are studies showing that in animal models how terrific the preservation of these neuromuscular functions are maintained without the disruption that commonly occurs with ischemia or with injury or with damage. And furthermore, we're seeing cardiopulmonary protection. Again, in some of the models, the animal models, where they have been subjected to quite restricted blood flow, we're seeing some stunning results where preservation of those muscles and of those tissues and of those functions without the ensuing inflammation that generally interferes with those. So whereas typically after trauma and those types of injuries, we're seeing a compromise in the heart or the lungs, that's not happening, or that's greatly reduced by using the cannabidiol during that time. Even after the particular episode, it can be used if there is an injury. And that's the other thing I want to talk about is injury. So this is a different concept of the brain injury. We usually talk about, of course, concussion or traumatic brain injury. I think that it's just a matter of degree for the most part, but concussion is a very subtle thing that we haven't paid as much consideration as we should. And I think it deserves a different look at it. Now, a lot of the emphasis in the medical field has been on the idea that, okay, a concussion, you have a coup and a counter-coup injury where you hit your head on one side and the injury actually occurs on the periphery on the other side. I think that's the farthest from the truth. I think the actual damage is occurring on the brainstem. And if you look at it carefully and you see the sciences behind it, you're seeing evidence of even a micro stroke that's occurring in the brainstem. What else happens in concussion? What are the examinations? What are the subtle findings in concussion? We're actually looking at brainstem functions. We're looking at how the eyes move. We're talking about coordination. Those are the subtle measures that determine if somebody's had a significant concussion, not from the MRI showing a hematoma or a major problem in that brain or tissue damage that's there. It's the microstroke. And these microstrokes are something that can lead to, of course, there's initial injury, then there's the ischemia. Well, that's what a microstroke really is. A stroke is an interruption of the blood supply. And so the concept, if we're talking about small vessels like capillaries, then we're really talking about a reduction in blood supply to those small tissues. Now, it's not major, so there's no interference with consciousness necessarily, but there is inflammation. You do have that process going on. And finally, that leads to degeneration. Unfortunately, after inflammation occurs in the brain sometimes, what we see is a continued degeneration of the tissues. Rather than a recovery and a rebalancing, it tends to go on. It may be years, it may be decades, but it does continue on. And cannabidiol may offer the protection even after these events occur to prevent worsening injuries and the degeneration that typically ensues with them. So the big thing about cannabidiol is the neuroprotection that's going on from these particular injuries. But we also see that CBD is protective in all types of injuries and healing of and preventing damage of all tissues. So let me talk about just briefly about cannabidiol, and that we're not seeing any adverse reactions. We're not seeing any toxicity or drug interactions, and there's no coagulation defects or variations. So you don't have to worry about adverse clotting. One of the things that it does do that we know about in clotting is that it prevents that hypercoagulation that can occur after an injury. So that thrombosis that might occur after a crush injury tends not to occur, and cannabidiol is working on the behalf of the platelets in terms of preventing that sort of reactivity. So let me recap this and try to pull it all together. Cannabidiol supports all aspects of performance, whether it's the head, the heart in terms of your emotions, the muscle, as well as the repair functions and the recovery. All of these are key performance aspects that keep our athletes and ourselves in top form. Cannabidiol is protecting the body from damage during injury specifically, and particularly for head injuries. Cannabidiol doesn't have any adversity or toxicity or interactions of any significance, and CBD helps to restore the optimal normal function. We're not talking about what I believe would be an unfair advantage. We're talking about helping the body recover normally. and to maximize its normal function. So that's the end of the talk, and what I've done is I put some references and the slide set for you to look at this particular Google address, and you can go there. It's open to you to read that and to look at those references and study up on them. And so it's been a pleasure to talk with you about these things.